Days, Fox Business, and others. Dwight has been providing articles of resource out in the community and on his website, which we've used both for our staff, for our patients, and for many others. One of the taglines that Dwight recently used was, "Breathe in faith, breathe out fear." How powerful is just that one line from you, Dwight? So with that, I'm going to turn it over to you, and thank you again for being such a resource and so giving of yourself in our community.
Well, thank you very much, Vicki and Gabby and the team. It tells me that I cannot start the screen share while the other participant is sharing, so we're going to figure that part out as we do. I just received this news from Orange County Mayor Jerry Demings. It looks like most businesses in the region will be closed until June 1. Repeating the news just out of Orange County Convention offices that our region will be closed until June 1. What does that mean? It means these mental health challenges that we're focusing on, the mental health challenges related to COVID-19, will continue to very likely get worse. Now, I'd like to jump into the PowerPoint. Again, the prompt for the tech team says I cannot start the screen while the other person, so we're working that piece out. So
Well, you should be able to share now. See if you can go ahead and share your screen. We stopped.
All right.
So let's see if you can go ahead and share.
And there we are. Good deal. Can you all see managing the mental health challenges of COVID-19?
Yes, but you're on presentation mode. Maybe there's a way to make it full screen.
I think I'll just leave it in presentation mode, just so that I can move us forward. So when we look at it, because COVID-19, as of last night, 7 p.m., 457,000 cases, 24,000 have recovered, 16,000 have died. Those numbers obviously are worse by this time, and we know the economy will continue to be shut down. The economic indicators tell us a lot of things. You may have seen over the weekend that calls to the U.S. helpline jumped almost 900%. The White House warned of a mental health crisis, and an almost 900% surge means that mental health services are already overwhelmed. For Central Florida, with the news this morning, and that's obviously just minutes ago, it's very likely it means then theme parks, resort hotels, airport, and maybe even the clinic environment where you work may be affected. The mental health surge continues. You see, right now, as we are still in the middle of this crisis, we're dealing with medical issues to keep everybody safe. Physical distancing has replaced the term social distancing. Social distancing, the White House, the Centers for Disease Control, in a press conference this week, announced that using the term social distancing has isolated some people, leading them into a depression, leading them into more suicidal thinking. Orange County coroner reporting suicides are up over this time a year ago, because when we look at the number of people contacting hotlines, 45% increase, and we're at not quite 1 month, a little over 3 weeks of COVID-19 intensity, and maybe another month to 2 months where people may be in a lockdown, businesses may be closed. And what does it mean? It means that callers are feeling overwhelmed, financially strapped. They're looking for information. Now, this is a good sign. They're going to be calling you. They're going to be calling Central Florida Behavioral Hospital. They're going to be reaching out to websites, the information we're posting at lifeworksgroup.org. They're looking for answers. That's better. I don't want people to hold it inside, but I especially don't want you to hold it inside. Because if you feel like you've been flattened by COVID-19, you're not alone. Somebody sent me this cartoon. I thought it was kind of appropriate. You know, life is good. And then what's Corona? No big deal. Oh, wait a minute. This is serious. Oh, wait a minute. The world is on lockdown. I'm still here. We're in this together. I hope that you're at the final stage and not critical everything or cancel everything, because this is going to go on. When Vicki said this is unprecedented, that's exactly right. Nothing like this has ever happened in this particular scenario. In some ways, this is battlefield conditions, and we have to give you new tools. That's why, thank you for blocking out time in your very hectic schedule to join us today. And we're going to be bringing you resources through Central Florida Behavioral as quickly as possible, so this becomes a trusted source for you, because we're dealing with a type of trauma. When we talk about trauma being defined in the clinical research, it's an emotional state of discomfort and stress. It results from memories of an extraordinary catastrophic experience which shattered the survivor's sense of invulnerability to harm. And what does that mean for you and me? Well, see, nobody's lived through this. The class of 2020 will be the graduating class of high school seniors, college seniors that didn't have a graduation. This will be remembered, 2020, as a defining point, not just in the United States, but in our world, because of a global pandemic that is absolutely reshaping everything. And that will create a type of trauma. And as we walk through this process, some people will get stronger, other people will struggle. I learned about the area of trauma working at the World Trade Center. In the early days of COVID-19, people said, well, this must have been what it was like in New York City, 16 acres of collapsed buildings in the financial district. Except it feels like that the buildings are still falling. The economic recession, the emotional tsunami is continuing. So what I've learned in working with natural disasters, shootings like Columbine, Parkland, Pulse, and what I've learned is that there are some predictable stages, right? There's the disaster stage, and we're still in that. Recovery and rebuilding. Now, let me give you a closer breakdown as you take a look. The disaster phase normally lasts a period of hours to days, but ours has gone on almost 1 month, with projections to maybe go on another month. Governor DeSantis has said the state of Florida is closed until April 30. And with the news this morning from Orange County Mayor Jerry Demings, it's possible that will be June 1st. What does that mean? It means some pretty significant mental health problems that are coming, because we're still in disaster phase. When we do get to the recovery phase, that will go on for a period of weeks to months. In some sense, the recovery phase, you can create a timeline, and I'll be writing about this, and we'll share it at Central Florida Behavioral. But you can create a trauma timeline, and if it's a 6-week disaster, like the California fires we saw 2 years ago, then it will be maybe 6 months of recovery. Now, the rebuilding phase will come, but that will take years. And my goal is to keep you as a caregiver, as a therapist, as a counselor, as a social worker. I don't know exactly, because of the technical limitations, who I'm talking to, but I know this. You dialed in because you care about people. You want to help people, and there's clinical research that shows a strong argument for providing acute psychological first aid as early as practical following a traumatic event. Did you hear that? As soon as possible. The problem is right now, some of this is not possible. Schools are shut down. Parents are homeschooling. We can't get to some of the clientele that we need to serve because they're on lockdown. This has never happened before. When the Orange County Coroner's Office shared with me how suicides are up, the big concern, someone said off the record, is that with the lockdown in Central Florida across all the counties, they don't know how many people are disconnected, how many individuals are away from a support group, and maybe gave up hope. And we'll know more of that in 3 weeks. This is a new experience of trauma and critical stress, and so we've got to give you as many resources as possible. So the requirements for traumatic encoding from the clinical research: you look at the event, the meaning, the environment, the perceived inescapability. Remember, many of you probably worked at Pulse and did Pulse recovery, because the more you feel that you are trapped, the more you feel that you are somehow locked in, the more the trauma. The individuals that were locked in bathroom stalls trying to stay alive when Omar Mateen was massacring people were more affected than the people that were able to escape. It's a concept called trauma multiplication, the mental health multiplier of COVID-19. And I've been working in the field of crisis management for over 30 years. I've not seen anything like this. When they say unprecedented, it means we have nothing to compare it to. But let's look at the stages. The first wave, the disease is spread from the global pandemic, right? We're still in that, and that is still going on globally. Most of the world shut down, impacted by this incredible disease that just seems to take over. And my friends who have had coronavirus, I will tell you, I've had two very close friends who have contracted coronavirus, tested positive for COVID-19. Both survived. The one said it just takes all of your energy away. He caught his symptoms early. He works in an office here in Orlando and feels like he probably caught it from a computer keyboard, a computer mouse, maybe a cell phone, car keys, some surface, because he just couldn't think of anything else. My other friend runs a mental health clinic in Atlanta, Georgia. He feels like he caught it from a gas pump handle, and his was much worse. He said, Dwight, it's not like the flu. He said, I had the loss of smell, the loss of taste. He said, but then it was like vertigo, and he's in his early 60s, more of a high risk group. And he said, I just felt like I was losing my mind. You can't work, you can't function. He said, it's not like a bad flu. It's like something I've never experienced before. Thankfully, my friend Tom in Atlanta will survive. My friend Dan here in Orlando will survive, but we're still in that first wave. This is still coming. This is like the Pacific tsunami 15 years ago. The surge is still coming because the second wave, and we're starting to see some of that with anxiety, panic, hoarding supplies. The big economic marker in this type of an almost apocalyptic situation is toilet paper. You would have thought it was gold, but if you had gold, I don't know if you could buy toilet paper. People hoarding supplies because of their panic. The third wave is the lockdown, the social isolation, the depression. We're starting to see some of that. The isolation leads to a complete sense of desperation. And that's the risk, obviously, for suicide. The financial recession, unemployment already happening. Over 500,000 people unemployed in Central Florida, either laid off or unemployed. The financial recession globally that we're heading into could be at least 12 months, could be as long as 2 years. I remember after the terrorist attacks of 9/11 in, what was that, almost 20 years ago, Orlando was not attacked by foreign power. Orlando was not attacked. Walt Disney World did not have terrorists trying to blow it up. But Orlando went through a 20 months of recession. And those 20 months were very difficult because people didn't want to travel. They didn't feel safe. We're a tourism-based economy in Central Florida. I don't know if you, like me, have friends and family that work at Walt Disney World, Universal Studios, SeaWorld. Those friends and family will be laid off, many of them already for a month, and it may be another 2 months, with the announcement from Orange County Mayor this morning. June 1st. June 1st. How are we going to get through it? Together. We'll get through it better together. Because you see, the financial recession, unemployment, that's just the fourth wave. The repossessions, the foreclosures, that's the businesses shut down. The bankruptcies, that's just the fourth wave. The fifth wave, funerals, loss of graduations, loss of normal birthdays. I've been working with clients, I'm sure you have as well, that have already had family members complete suicide, and you can't have a funeral because you can't have more than 10 people. One couple I talked to yesterday, their son was in his 30s. He was worried about the stock market, felt like a financial failure. He'd always had perfect credit. And he realized, I'm not going to be able to pay my bills. My company may lay off. And the panic, the fear, the dread, he gave up. He gave in. And the family couldn't have a regular funeral for their son, and because you can only have 10 people. They had family members sitting in cars in the parking lot of the funeral home and holding up a cell phone as they videoed from inside. That's just the fifth wave. The funeral business, individuals who have died either from the disease or died from the mental health. And right now it looks like that the mental health side will lead to far more deaths, far more domestic violence, far more hardship than it will be from the disease itself. That's the fifth wave. The sixth wave, PTSD. CPTSD, complex post-traumatic stress disorder, complicated grief. I was very happy when yesterday Vicki said, would you like to teach us about complicated grief? Because many times in the mental health community, complicated grief is misdiagnosed as depression. And so 1 month from today, I'll be back with you to teach the differences between complicated grief, COVID complicated grief, CCG, because it's quite different. If you've lost your job, your home, maybe lost your marriage, maybe gone through the financial loss, maybe you had your kids in private school or you were saving for their college, and those things are taken away one by one by one, like dominoes falling down, it's complicated grief. That's why we'll be back in a month to talk about it. And please tell your friends, because of this learning platform, we're not limited like we were before, where we could only fit in 100 people. You can invite other clinicians. This is going to go on months to years in terms of the recovery. And why are we taking these bold steps? Because of suicide, domestic violence, children that will be violated. The first week of the coronavirus lockdown, some wonderful friends of ours, daughter, called and said, I have to talk to you. Okay, sure. We FaceTimed. A neighbor had sexually violated their daughter, who was 2 years old. And you say, well, why would somebody do that? Pedophiles, when children are sometimes not as shielded. You've heard of children in the last few weeks that have either been violated, abused, drowning. Children in the middle of a war zone struggle the most because there's nobody there to protect them, because children look to mom and dad for support. And if mom and dad are screaming at each other because they're worried about losing everything, the children are traumatized. And what does that do? It lays the foundation for PTSD-related mental health issues, not just for now or the next school year that will start again in August, maybe for the rest of their lives. Some people are impacted by trauma forever. That's why we'll be bringing you resources to be able to help. Let me jump back to this screen. All right, COVID. I want you to think in the terms of an exponent, just like in math. An exponent multiplies what's already there. With COVID, we know there's material losses. That'll be things like your home, financial losses, relationship losses. Some people that, one college student that I talked to said, and she was sent home, she said, all of my friends in college, I'll never get to see again because there will be no class of 2020 graduation. Identity for people that were maybe had a powerful job and that company will close in bankruptcy. There's functional losses, your role as a mom, a dad, your role as perhaps a teacher. The functions have changed. Cultural changes, mobility changes, because I'm not sure how much people will travel in the days ahead or feel safe to travel, or even if they could travel to parts of the world. The world you knew as normal is gone. What does that mean? A mental health tsunami is building. Tremendous personal anguish and suffering. Can you think of the moms who already were working a job and now they have to homeschool and now they have to become a therapist for their terrified middle school daughter who maybe struggled with cutting and eating disorders before, and now there's a lack of support. That's why I've got to give you as many tools as possible, because I want you to be equipped to help the people that I'll never meet. You will help people that I'll never meet. That's why I hope you're taking notes. I hope that you'll stay dialed in, connected to us. At Central Florida Behavioral Hospital, they're going to provide a platform that I can just give resources so that you can go help people, because our region, it's rippling. I'll talk about that in a minute, because it goes economic, social, political, and philosophical. You see, 2 months ago, people would scream and shout about red states. They would stand up on a soapbox and tell you that blue states were the best. And now there's no red states, there's no blue states, there's just United States. There's philosophical changes, political changes. I've seen that after major disasters. You'll see the worst in people, price gouging, ridiculous things like the guy in Tennessee who hoarded 19,000 bottles of hand sanitizer and Clorox wipes, to price gouge until the state attorney in the state of Tennessee shut him down. And people cheering, because price gouging, they said, who would do that? individuals that bought up face masks to price gouge, and other individuals, even Hollywood celebrities, shaming them on social media to say, stop it. The heroes in this battle are first responders, nurses, doctors, individuals that are testing, and people just like you. Mental health is an essential service, Governor DeSantis said, and you're part of that because people's social networks are overloaded. Some people are not able to work. I talked to a young man this week. He has a job, but he said, I don't have any energy to be able to work. Obviously, the loss of community connection because you can't go anywhere. And eventually societies can weaken or shatter. Now, I'll address that for just a moment because somebody said, do you think that the Colombian drug cartels are going to attack? I said, what are you talking about? He said, well, I saw this thing on Facebook that said with the United States almost in biological warfare that our enemies will try to attack us. And I said, get off of Facebook. But I will tell you, in the absence of information, people will make up information. In the absence of truth, people will make things up. What does that mean? I want to give you some factual information to base it on. Now, what's the impact of coronavirus? It's rippling out right now. It's more medical. It's more physical, just your physical safety and medical symptoms. But it's going to start to ripple out into not medical, but mental, not physical, but psychological. It will start to ripple out into economic. It will ripple across society. And because of that, I want you to see mental health crisis in this type of a COVID pandemic. It's very complicated. Very quickly, COVID is a traumatic reaction that takes hold of a person's mind. It won't let go. When I talked to my friend, the clinic director in Atlanta, he said it felt like it took over my mind. He said, I was hallucinating. I didn't know where I was. Sometimes people say, well, if I got it, I'd keep working. Not the two people that are friends of mine that got it. A paramedic that I talked with yesterday said that a paramedic on her team has been running consistently about 104 temperature battling against COVID. You're not going to work. It's a different type of crisis. Troubling thoughts, dysfunctional behaviors, problems regulating emotions, and everything starts to spin and stall. People facing COVID-19 mental health crisis cannot function properly. And if you're the caregiver, you could get overwhelmed very quickly. See, they assume that their lives have been forever damaged. They can't see beyond that. So anxiety starts to take over. Some feel helpless, frustrated, discouraged, even professionals. I'll talk more about that at the end of today's presentation, because there's some dangerous warning signs of trauma overload. Maybe some of the patients that you see, the clients that you see are facing the trauma factors. Now remember, every single one of these will escalate the level of traumatic reaction psychologically. Suddenness, if they had a previous history with trauma and loss, if they lost someone that was close to them, the lack of coping skills, lack of supports, their faith system being affected because churches are shut down, and this is Easter weekend. Obviously, cultural changes, facing multiple events. We saw that in the Great Depression, and right now things are shaping up to look an awful lot like 1929. The more mental and physical health history they had, the more they witnessed things, the more that they've had what are called secondary losses, obviously their age. You see, before COVID-19, trauma was a car accident, a natural disaster, a disability, a divorce, a marriage partner cheating. But now, when we start to look at the multipliers of COVID mental health crisis, every single factor becomes like a brick. And eventually it leads to a wall of numbness and shock. And it leads to mental health challenges. We're going to see a spike in depression, self-destructive behavior like drug and alcohol addiction, rage. We're going to see a spike in suicide. And I'm going to give you the tools for this battle against the mental health crisis so that you can battle back and be the next round of heroes in this battle. Right now, it's paramedics, ER docs, people working in emergency rooms, nurses, individuals, and they're in the front line of the battle. The next battle is coming to you, mental health. The next battle will be mental health based, and we have to be ready for that because people facing prolonged traumatic stress, and remember, this is going to go on another 3 to maybe 10 weeks. Denial, this isn't happening. The world will come back to normal. No, the world that we knew last month, that world is never coming back. We can build a new world. We can survive this. But people that are overwhelmed, panic, exhaustion, they avoid, their emotions are flooded. Obviously, psychosomatic illness, which is clogging some of the COVID testing sites because they think, I think I've got it. I think I've got it. And psychosomatic illness is real. Obviously, the mood disorders. There are physical symptoms. You've heard a lot about that. Wash your hands. I was on a conference call with the Surgeon General of the United States, and he said, wash your hands twice an hour, and then wipe off your keyboards, your cell phones, at least twice a day. Physical symptoms, that's the medical part, but let's look at the psychological, the mental and the emotional symptoms. Those break down anxiety, irritability, depression, grief, anger, mood swings, fears, phobias, phobic avoidance. PTS is something called post-traumatic stress. We all have that right now, but you don't have to be overwhelmed by it. Secondary traumatic stress, STS, is a re-exposure. That's why you want to be particularly careful to not continually watch the news. You can actually depress your mood. The severe emotional dysfunction, panic attacks, overwhelmed feelings. You'll start to see adults act like little kids, screaming, shouting, trying to prove that they are right. We're in a battlefield situation. People are on lockdown. And so you have to be able, in the middle of this situation, you have to be able to protect your own emotions. We've got to keep you calm so that you can help the people around you. You know the types of depression, flat affect. You understand PTSD, and hopefully I'll be able to come back and explain that one in greater detail. Because you see, the severe emotional goes to behavioral violence. We know domestic violence calls are up dramatically, but because people can't get out, sometimes they can't escape and they can't get to the safe house that maybe before they could get to. Antisocial acts, abusing other people. And the antisocial, you'll see that on social media as well. Compulsive acts, they don't shower, they can't sleep, they self-medicate. The cognitive symptoms, when it's severe, you're looking at guilt, time distortion, confusion, suicidal thoughts, inability to concentrate. They can't make a decision. And right now, if you aren't thinking clearly, don't make a major decision. Don't decide you're going to marry that person that you've been dating for 3 years. Don't decide you're going to sell or buy. Take a breath. We will get through this, but I want you to look at severe cognitive functioning or dysfunction. People just give up on living. They're disoriented. They're paranoid. They'll go through psychogenic amnesia. They'll go into catatonia. They'll have disabling guilt, thinking they caused it, hallucinations, delusions. Now remember, this is before they actually have the virus. And they just sometimes completely lose touch with who they are. There are spiritual factors as well. Because everything that you believed about America, everything that you believed about our country, society, our economy, a lot of those things are shattered right now. We will survive. I want you to hear hope in the middle of the hardship. You see, when your core beliefs get shattered, all of a sudden your thoughts about a fair world, a just world are gone. Belief in my job. Can I provide for my family? Things are shattered right now for many people. Over 500,000 just in Central Florida. Over 10 million nationally. I've been told that Las Vegas will have the hardest economic recovery. Second will be Orlando, because both are heavily dependent on the hospitality industry. Right now, timeshares are shut down. The Orange County Convention Center has been empty since the first week of March. But what about our government? Remember, in the middle of a crisis, there's not red states or blue states. There's United States, but we have to come together and not be attacking. We have to work together, because if not, you make it worse. Now watch the difference. STS may be a new term for you if you don't do crisis work. This may be a new terminology, so don't get lost in the initials. Secondary traumatic stress is normal. Something traumatic happens and you witness certain things, normal. Post-traumatic stress disorder, PTSD, is a life-threatening variant of a survival response. When you see something traumatic and stressful, it's normal to want to pull back. The problem with this one, it's gone on for a month. It will go on at least another month, but it may go on 2. Watch the steps. Here we go. And looking at crisis mental health, the stress response, the symptoms I just gave you. Cumulative stress means it goes on and it perpetuates. And we're still in that churn cycle. This is Hurricane Dorian, 24 hours locked down on just a few of the islands in the Bahamas. And what did the churn do? It just shattered and decimated everything. We're still in that churn. Take a breath. We have the tools and resources. We will get through this together. But it leads to exhaustion and depletion. That's why you must practice self-care. Every single day when the stress is higher, you self-care more. I knew that today I needed to give you the best I've got from working the field of crisis over 30 years as a senior instructor in this field. So at 4:44 a.m., I was up so I could spend 90 minutes, exercise, weights, reading, meditation, prayer, spending time reading the scriptures. This is Good Friday, as Vicki said. When you know the needs are great, you must practice self-care. ER doctors, paramedics understand if you're not in surgery, you must deal with the things inside of you so you don't carry it home, because you'll get exhausted, you'll get depleted, you'll burn out, and then you haven't helped anybody. It leads to acute stress disorder, PTSD, and self-destructive behavior. My friend Daniel Amen, who's a leader in the field of SPECT imaging, the Washington Post says Daniel is America's most popular psychiatrist. He described it to me this way. You'll see the image of a SPECT scan of a healthy brain on the left side. PTSD is from trauma. PTSD is a diagnosable mental illness, but it's not caused by mental illness. It's caused by trauma. That's why I don't want people to feel ashamed. You see where it's red, where it's white hot, the ring of fire, because that person cannot turn their thoughts off. The trauma is there. And traumatic experience plays out in this Venn diagram. You'll see there's trauma, there's bereavement, and there's the interaction between the two. Remember in the beginning when we talked about COVID has multiple losses, but some of those losses will go into relationships, not knowing how to trust, having difficulty being close to people, having problems in sexual relationships, or for some people, becoming hypersexual because they just want to feel. You'll see that sometimes. The TV show Grey's Anatomy kind of pokes fun at it, but they say, why are these doctors so hypersexual? It's because they're so numb from so much trauma, they'll have casual sex or high-risk sex just to feel something because they can't feel anything. Being afraid of other people. We're going to see a spike in agoraphobia, individuals that have social phobias, social anxieties that really can't work and function. I've got to get you prepared because that's coming. Being more isolated and withdrawn, not recognizing dangerous situations or repeating traumatic patterns. An example of that would be somebody in domestic violence who goes from one DV situation to another because they just can't think clearly, not knowing how to give and take. Some people get very self-absorbed in this type of a crisis, repeatedly searching for somebody to rescue them, which is why people are so susceptible right now to online catfishing, online scams, and hucksters. If you don't know what catfishing is, it's somebody who says, I will be the love of your life, and they're on Match.com, and they're just a con man trying to take money, especially with the economic recession spiraling toward a Great Depression level. We're going to see people that will lie and manipulate, and you must keep your mind clear to be strong against the manipulation that's coming. If you can think clearly, you'll be fine. Right now, life looks like this. It's all about the pain, the difficulty, the stress that I am facing. That's what it feels like this minute, right now, for millions of Americans. Here's where I want to see all of us in the next 6 months. Life after the lockdown. If you use crisis mental health care, some of the resources that Gabby mentioned, it'll be available to you at the website. You can visit our website. I post these tools because I want to give you the resources to go help people that I'll never be able to help. Because you'll see that the pain starts to get covered over by living again. You're able to find a reason to breathe. We're going to survive. When you reach the age that I'm at, you probably will hardly remember COVID-19 in the spring of 2020. Life will go on, and you will be able to go on because we're going to learn some skills. Let me teach you some of them so you can share with your patients, with your clients. You can share with you. You say, where do you find all this, Dwight? There's a lot of information. Go to cdc.gov or coronavirus.gov. You can look up the daily coping, managing stress and anxiety. There's PDFs on every one of these topics from the CDC. The foundation that I teach for in Baltimore, the International Critical Incident Stress Foundation, ICISF.org, ICISF.org, has resources for me from other crisis authors. The tools are there. Turn off Netflix. You don't need to know that much more about tigers and people that follow and take care of big cats. You've learned enough. We all learned enough that week. You don't need to be on the hunt for more toilet paper. By now, you figured that one out. My wife got pretty clever. She started bartering because we had a lot of paper towels, and we bartered with a neighbor who had a lot of toilet paper but didn't have paper towels. Desperate times, people get creative. Get information from trusted sources. CDC.gov, coronavirus.gov is a website designed by the Surgeon General to give you trusted information, and much of that information, not just medical in nature, much of that information is mental health in nature. Rollins College, I attended, like many of you. And at Rollins College, one of the esteemed alumni, Fred Rogers from Pittsburgh, Pennsylvania, actually a suburb of Pittsburgh called Latrobe, Pennsylvania. Mr. Rogers said, all of us at some time or another need help. Whether we're giving or receiving help, each of us has something valuable to bring to this world. That's one of the things that connects us as neighbors in our own way. Each of us is a giver and a receiver. And I want you to understand, it's okay to ask for help. Mental health is a normal part of our life experience. 1 month ago, when you were starting to hear about coronavirus and COVID-19, 1 month ago, you knew that mental health was important, but society said there was a stigma. Oh, I don't want to go to a counselor. Oh, I don't want to talk about mental health. Oh, I'm not crazy. I want you to know that because of COVID-19, I think that right now the stigma is being shattered. You have some of the top people in America talking about counseling and how their therapist is helping them through, how somebody just like you is going to help them stabilize their symptoms, reduce their symptoms, get back to stable functioning, or if they can't function, that's why this webinar is being provided to you as a gift from Central Florida Behavioral, because there are resources available. You heard Vicki talk about virtual, online groups, resources, telehealth that's available to help patients that are struggling with severe mental illness, or they're going through it alone. No, they're not. There are tools and resources that are available right here, right now. And that's why I want you to take everything that you're learning. I want you to share it with others. One of the things that'll be made available to you after this presentation, it's recorded. I want you, once you get the recording link from Gavi, take that recording link, put it on your social media. I want to multiply this message to other people. Mental health recovery must be in place after lockdown. Here in Orlando, that's 3 more weeks. In other parts of the country, New York City, that may be another 2 months. Metro-Dade, Miami has the highest number of cases right now in Florida, followed by Broward, followed by Palm Beach County. It's working its way up the state. I didn't look at the numbers this morning because I was so shocked by the news that Orange County may be closed another month. That means hair salons. That means individuals that work at Jersey Mike's or Subway. That means being able to take your mom to Olive Garden for Mother's Day. Those things may not exist. We're in a new world. We will survive together. But when I talk about facilitation to continued care, I want you to take that link of today's broadcast. I want you to share with other people, because we're in this together. And together we're stronger. You're not in this alone. You have fellow practitioners, professional colleagues. You're not in this alone. But we do have to help each other. And there are people that you know in your circles of influence that I'll never meet. But I want to give you the tools and resources, the articles from Central Florida Behavioral or from our website, lifeworksgroup.org, lifeworksgroup.org. Get the tools, the information, the mental health coping tools into the hands of the people that are battling, the people that are trying to build stability in the middle of this, because together we can get through it. Please do your part and help us share the message. So how do we help people recover? And then I'll take some questions. I want to reconnect them to social groups and social networks. You say, no, social distance. Remember, the term changed this week. from Jerome Adams, Surgeon General of the United States. Incredible guy. The other day when he shared with our leadership team, he said, I'm Catholic. I grew up Catholic, and we do Easter egg hunts since I was a little boy. And he said, this year with my aging parents and my kids, we are practicing what I'm teaching. I will not be going to a Good Friday service. I will not be taking Holy Communion. I will not be going to an Easter sunrise. I will not be endangering my mom and dad. Physical distancing, he said, but you can FaceTime, you can Zoom, you can text, you can call. My friend Russ Rollins over at Real Radio, Monsters in the Morning, is sending greeting cards to his mom who is in a nursing home. You can still go to Publix and get a Hallmark card. Just remember not to lick it. Don't lick the stamp. Don't lick the envelope. Use a moistened paper towel. You can still reach out to your social networks. Please do. Your professional colleagues that you haven't seen, please text them. Check on people. Yesterday, I checked with a dozen different senior leaders in an organization, and one of them, tough guy, a military Air Force before he retired to work for this organization as a first responder, was almost in tears. He said, nobody stopped to ask me how I was doing. Obviously, we're paying attention to safety, practical assistance with daily things. Talk to each other. I'm telling you, if you have toilet paper and toothpaste, and you can swap that for somebody who says, we just need some bananas, we get through this better when we get through it together. Sharing positive information like cdc.gov, coronavirus.gov, lifeworksgroup.org, some of the websites I've talked about. It's okay to talk about life on the other side of COVID. It's okay to talk about your losses, the lost jobs, the things that'll be happening. It's okay to talk about how you survive, because you sharing your story will help other people share their story. That's what builds resiliency. You see at the bottom of the slide, it says, talk through it to begin to heal. And when you heal through it and you talk through it, you're building resiliency. Now that takes courage, right? We're going to grow in resilience. If you're dealing with a tough time, I want you to think of a tree in my front yard I thought my wife was trying to kill years ago. They're called crepe myrtles. You probably have one in your yard too. They're decorative blooming trees. But around the last frost of the year, and these trees are beautiful. Beautiful blooms. Ours is pink colored flowers. You chop it down to the trunk. The first time when my wife did that, because she has an amazing green thumb, I thought she killed it. I said, what are you doing? I came home and this thing had been 20 feet tall and now it's 4 feet tall. And she said, you have to prune it back. You have to cut it back. Why? Well, that's what it looks like a week later. This was 2 days ago. It had been cut down for a month. That was 2 days ago. You see, when something is seriously pruned, and our culture right now is pruning, things that before people fought about, religion and politics, and Khloe Kardashian is the best. No, Taylor Swift is the best. Now it's all about growth, but I've got to keep you healthy. You're going to help people that I'll never be able to help, but you must keep your battery charged. You may be working in telehealth like I am. And because of that, and I use different platforms, Zoom for some things, C3 Now for others, WebEx for others. I'm able to use FaceTime in some situations, but it means between my 2 cell phones, my 2 battery backups, my 2 exterior lights, because you want to have proper lighting when you're doing telehealth so people can see your face, exterior microphones, headsets. There's a lot to it. I've got to keep the battery charged. In a battlefield situation, soldiers are trained to do things a certain way. You say, why do we have basic training for soldiers? Simple. Because you want them to be able to, in the middle of the night, if there's a noise, for them to be able to strip down their weapon, put it back together in the dark, and do it in less than a minute. You want individuals to be able to very quickly and very actively and very aggressively be ready for battle. And you have to stay charged up. You have to sleep. Navy SEALs, first lesson they teach, get up on the first alarm. You've got to keep your battery charged. That process of self-care, as it's called, right? Self-care looks like this. You're sheltering in place? Good, shelter in health. You're sheltering at home? Shelter in health. Let me challenge you. Physically, emotionally, relationally, behaviorally, spiritually. I want you to be able to grow. You know, it's interesting. A month ago, Vicki, a month ago, the average American said, if I just had more time, I could get things done. If I had more time, I could finish that stack of books. If I had more time, I could write a book that I've always wanted to write. If I had more time, I could learn to play the guitar. If I had more time, I'd clean out my closet. If I had more time, I'd be able to stay connected to the people that I love. I'd start a journal. I'd write out how I healed in my own mental health journey. Well, here's the deal. Here's the deal. Americans got more time. They didn't know they were going to get it because of COVID-19. They didn't know coronavirus would help them with their New Year's resolution of more time to read, to get out of debt, to file my taxes early and get a refund. They didn't know they'd have a month of time, but when people tell you that they don't have enough time, what they're telling you is they don't have priorities. When somebody says, I don't have enough time to get things done during coronavirus lockdown, what they're telling you is they have no discipline. Come on, breathe. I need mental health professionals to lead the way. There's a surge, a tsunami as tall as a skyscraper coming. It's coming to our community. We must be ready physically, emotionally, relationally, behaviorally, spiritually. You've got to be strong and ready and prepared because COVID-19 will not last forever and your relationships are not lost forever. I'm a caregiver for my dad who has dementia. We go on adventures every Sunday, but not the last 3 weeks because I've been out and exposed. But I'm going to take my dad on adventures again. Dad and I are going to Weeki Wachee Springs as soon as this is clear because he took me there when I was a kid. I want to take my sister because she always wanted to be one of those mermaids. Relationships are not lost forever. You'll go and you'll count blessings instead of problems. I hope that you're connecting to your family and that you're closer. Your marriage is better. Your relationship with your partner, your kids is better with your neighbors. Have you learned your neighbors' names? Some of those neighbors have toilet paper and they'd probably swap you, maybe for free counseling. I don't know, but I know this. Life will go on if you find hope and inspiration. Inspiration in simple things. For me, as I already shared with you, because through the middle of this, I ramped up my self-care from about 30 to 45 minutes a day. I doubled it. So at the end of the day, my batteries are still full. Right now, you're either living off of a reserve and you're burning energy or you're burning out, or you're putting energy into the tank for the journey ahead. We're still in disaster mode. Remember the timeline that we talked about? We're still sliding. The recession, we won't know what those numbers are for 6 months. We're still in that disaster pounding, Hurricane Dorian spinning. You must keep your energy tank full. You must keep your reserve tanks full. Scuba divers keep a reserve. They get a warning at 5 minutes to save their lives. And one of the things that helps me every day when I'm in the car, I listen to Z88.3. Z88.3, one of the top radio stations in Orlando. Nothing negative. They're safe for little ears. Yes, I'm on the board there. I was there when it started. They're my friends, but I'd still listen every day because I need positive. For some people, they find inspiration to be out in nature. You're allowed to do that. Governor DeSantis said, yes, get out in sunshine. Last week, my wife and I biked the Katy Way Trail. We'd never done that one. Normally it's West Orange Trail, 13 miles. Simple things. Did you know the sale of bicycles right now is through the roof? You can't find a jigsaw puzzle. Americans that before were complaining about there's not enough to do, I'm bored, because there were 1,000 channels on their cable system, are now gardening. Now they're taking up needlepoint and crochet. What's happening? There's a cultural shift toward mental wellness. John Gordon is a sports psychologist in Jacksonville. John's an incredible writer, wrote a book called The Energy Bus. John posted this on Sunday. I thought it was very powerful. Maybe, Gabby, we can get this, throw it up on the website, because what do you want to be doing during COVID-19? Do you want to live in the fear zone, hoard food, toilet paper, medicine, cold medicine that you don't need? Do you want to transmit your anger, your fear? You want to dump on the people that you say you love, or you want to be in the learning zone? Did you know if you have a guitar, that Gibson guitar, Fender guitar, the people that make guitars are giving you free online guitar lessons right now? masterclass and so many other classes. LinkedIn.com, I'm heavily involved with as an influencer on LinkedIn, top 1% in the field of mental health. And if you don't follow me on LinkedIn.com, just go to LinkedIn.com, click on my name. I always will follow, because there's a career tsunami coming in the field of career. Your job will either be getting better, you'll be more valuable in the future, or you may be replaced in the future, because we're seeing not just telehealth growing, but online services that provide counseling for free or next to nothing. Could that replace somebody coming to an office and you have a 12 by 12 office somewhere in your private practice? If you're not cutting edge in your career, it could. That's a real risk, but not if you're learning. If you're learning because your story is different than mine. Your healing journey's different than mine. You'll help people that I'll never help, but you have to be learning to get into the growth zone. So what helps in COVID recovery? Confront the loss, acknowledge the pain, normalize the emotions, face your fears, and the fears will start to die. Help other people with the Yahoo principle. Yahoo! I taught my kids that when they were young. They'd bring me a problem and say, "Daddy, can you fix the problem?" And I'd say, "Yahoo!"
Dwight, did we lose you
Yes,
there?
sir? Can you hear me? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Dwight, I think we might have lost your audio. I don't know if you can hear me. Hold on one moment, guys.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 1, 2, 1, 2, 1, 2. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All right. Ryan Gallick said he can hear me. So Ryan, I have you up on text. If you can hear me, send me a big thumbs up. Even if audio is lost on the recording, we are going to go forward. So Ryan, if you'll send me that back, if you can hear me. All right, Ryan gives me the thumbs up. Ryan, one of the leaders in the field of crisis mental health here in Central Florida. So Ryan can hear, and I want you to know we have to look at getting through the tough time by learning from Dr. Viktor Frankl. He was in a Nazi death camp, a concentration camp. And one of the things in a concentration was able to tell people is that you always have control of your mindset. Everything can be taken from a man, but one thing, the last of the human freedoms, is to choose your attitude in any given set of circumstances, to choose your own way. You and I can choose in the middle of this crisis. You and I will get through this crisis, but we have to stay connected. So I put up my social media information. I've given you my personal cell number. And if something is going on, all right, Kelly Matthews, thank you, Kelly. Kelly says that she can hear. Kelly, you always bring me joy. Thank you for introducing me to Central Florida Behavioral Hospital so long ago. Such good friends. So since I can't hear you on my headsets, but I can through text. So Gabby, if you have something, or Kelly, Vicky, just send it to me. I want to stay connected to you. That's my cell number. If you send me your contact information and you have a question, use text. I don't answer voicemail. But if you send a text, I'll be there, because you're going to help people that I'll never be able to help. Listen, we are in this together. We're in this together, and I want you to know that together we'll make it. There is a coming tsunami of mental health problems, but the good news is that together we will be able to survive, and I'm glad to be on the journey with you. Gabby?
Dwight, this is Vicki. Are you still there?
Yes, Vicki, I can hear you now.
Okay, so our first Zoom, and I think it went very, very well. We're getting feedback that your presentation, as always, was excellent. We got kicked off about 5 minutes ago, so this is our first time, and as I said, we are stretching our skills and our abilities, but I think this was a huge, huge success. Did you get to answer any of the questions?
I'm answering in the chat box right now.
Okay, great. One that I think would be a good wrap-up is one of the individuals said that they are feeling themselves being much more tired after the Zoom sessions versus the in-person. Is there a way that maybe you could address that, and then we'll wrap up things?
Yeah, when we are, and I'll tell you exactly. Thank you, Vicki, and thank you everybody in the chat box for your kind words. Listen, we're in this together. Please go to lifeworksgroup.org, lifeworksgroup.org, or go to Central Florida Behavioral. Over 100 pages of COVID mental health coping. There was no study guide today, but over 100 pages of resources already available. You can also go, I'm a contributor to WFTV Eyewitness News. It's on the WFTV website. I'm putting the information out there. There's no cost for any of this because I want to give you tools. Here's the reason you feel more tired. It's a great question. It's because you're looking at a screen. And normally we'd be sitting together, and I'd say to turn to somebody next to you and answer this question. You see, there's power in group. We gain immunity in small groups of community. We will meet again in the gymnasium at Central Florida Behavioral, fighting for a parking space because everybody wants to reconnect. We'll enjoy the best catered breakfast in Central Florida for mental health. But the reason it feels a little and a little down is because we're not face to face. I hope that you'll go on Instagram, my YouTube channel. I'm posting 1-minute videos every day to keep you moving forward. I've learned a lot in the field of crisis management in 30 years. And what I've learned is this: take care of you first. The oxygen mask drops from the ceiling, put it on you. Take care of you as a mental health practitioner. We need you. There's a coming surge and a mental health tsunami from COVID. The economic part will go on now, we know, for another month to 2 months, maybe 6 months with the housing market. We need you to be strong, stay connected. And the reason you feel a little down is because we're not connected. So please connect to each other through social media. You had my cell number earlier, 407-406-3375, 407-406-3375. If you just send a text and you don't tell me who it is, that'll go to delete. But if you say, hi, this is Kelly Matthews, all right, then we're going to be connected. You've got my cell number, and I'll be able to answer your questions. We're in this together. And Vicki, thank you. I know I'll be back in a month. We'll talk about complicated grief because by then the funerals will have started. By then the graduations and Mother's Day will have been canceled. But I know that we can get through this together. And Vicki, thank you for, even though the technical gaps were there, thank you for the chance to be part of a healing conversation to make my hometown a better place. God bless you all.
Thank you, Dwight. We'll see you all next month.